Hello, everyone. Welcome back to our daily lives. We're on here promoting the CT Nurse Wellness Summit that is happening on October 4th at Quinnipiac University in North Haven, Connecticut on October 4th. Um,
Yes.
yeah, so I am, you know who I am. This is my page, Dr. Wendy Garvin Mayo. One of the co organizers, along with my co organizer, Nakia Jackson. And Nakia,
Yes.
tell us a little bit about yourself. I don't think we really introduced ourselves yesterday.
Yeah, we did. And I think we did earlier on, but yeah, it's always good for reintro. So, Nakia Jackson, I am a nursing well-being strategist, helping healthcare organizations prioritize well-being because realizing that well-being is the foundation to any workforce. It's important that you are prioritizing you. So, former ICU nurse, turned patient safety specialist, now the founder and CEO of Holistic Health Coaching with Nakia RN, LLC.
Yeah, sounds good. Sounds good. So today I wanted to talk about mindset. I think, mindset is so important. I think we touched on it a little bit.
Mm,
But I want to talk about it from the perspective of us thinking differently to do differently. Um,
mm,
around like wellness, stress management, um, opening up your mind to different possibilities. So what are your thoughts
yeah,
on mindset in terms of wellness?
yeah. Ah, lots of thoughts on that. I feel like it's a huge part of well-being. I think for many of us, we all come with our patterns and beliefs and our conditions, especially as nurses. I know for both of us, we talked about being in this profession for a while, and there's certain things that we've, kind of kind of been holding on to for a long time. I think with this, part of those beliefs are this, that it's patients first always, and everyone else, if you have to care for yourself, like it's selfish. So I think even in part of those beliefs and mindset certainly have an impact on, I think, how you lead in life. And I think changing our thoughts around the way that we see just the care for ourselves is huge. As you said, the ability to open ourselves up to just new possibilities and opportunities. It's very freeing, I will say, even for myself, of thinking of myself, especially as we all age, and there's always this belief, oh, I'm getting older, I can't learn anything new, that has that very kind of a fixed mindset. But the idea of being open, and that that there are, you know the more that you have this belief that I do have the ability to learn new things, and to just be open and curious is one of the things that I tell people a lot, people that I work with, as far as clients, organizations, even with my own kids, of how important it is to not be so locked in, especially to beliefs that could be very limiting for us, I would say. So mindset is it's huge. I think it's foundational to growth, in all aspects.
Yeah, no, I agree. I agree. And I think, I don't think, but I know we all have our patterns, like you said, and sometimes it's hard to shift those
Mm,
patterns. And I think when it comes to like wellness and well-being and stress management and all those things, it's kind of like, I don't really want to talk about that, or I don't want to try that, or this doesn't work for me, right? I tried
mm,
it, whatever, like even meditation and yoga. I hear people, a lot of people say that, like, it's woo woo, that's not going to work for me.
Oh, that's
So,
good for those people. That's not good for me. Like they can do that.
yeah. Yeah. So I think it's being open to trying new things or retrying new things with a different mindset coming into it open. Because when you're open, that's when things start to happen. If you go in
Mm,
with a fixed mindset or a closed mind and negativity, right? That nothing will happen. So being open to the possibilities of
Absolutely.
what life can be, what things can be, and shifting from where you currently reside mentally.
Yeah. Oh, that's such a good one too. As you were saying that, it made me think a bit about um, just how freeing I think that is when we really think about just being open to possibilities. Like, I know for many of us, we need to like know what the end result is. We're always just so like, I need to know what that end is. But when shift, I think that, some of that inner dialogue that we have with ourselves, and reframing it in a way of being a bit more open. Like, yeah, I may not know, I don't know what the outcome particularly is going to be, but I am open. I am open to the possibilities and opportunities that just it opens you up, for lack of better words. It opens you up to what is available to you and what is possible. And I think we get very locked in as adults sometimes in this, like, in this adulting life, that we lose almost like that beginner's mindset. And also just that curiosity is like, as kids, as we had, like being so open and curious. And sometimes, we need to go back a bit and just explore that childlike wonder, like we said, and just that being really curious to what is possible. And that's all centered on your well-being, and just how you see the world. Yeah.
Yeah, no, absolutely. Totally agree with you. And I think the summit is one of those things, it's being open to the possibilities of trying new things, coming in with a different mindset, different
Mm,
perspective. Not that it's going to be the same old, right? Because even though it may be the same old, some things, it's how you're approaching it, how you're coming
mm,
into the situation. So
yeah.
it's something that I've been thinking about as we're, planning this summit, and people are, reviewing the registration page, and hearing us talk about wellness and well-being. It really is, you get what you put into it.
Yeah, that's so
So
true. And I think it's so true with a lot of things within life. And I'm so excited for this summit because of, again, what we were talking about, just with the possibilities of what that brings for
yeah.
people. So coming into this with like, yeah, I may not necessarily know, but I'm open to exploring and discovering. And there's going to be such an amazing array of opportunities to be able to refill your cup. That there's so much, as we talked about even yesterday, there's so much happening in the world. There's so much, in the South Side, it can become very overwhelming of what to do, how to, just stay grounded. And when all of everything else around you feels like it's spinning. So
Yeah.
coming to this summit and leaving with some tools and some strategies for, not just for work. So we're talking about for your life, for every day, because all of it applies. So it's a great opportunity to reset, to reconnect, develop some newfound community with some other like-minded individuals. And again, exploring, as we talked about, just possibilities, exploring new opportunities that you're like, I don't know, I never thought about it in that way. I never thought that it was something that I needed. But allowing yourself to be open and exploring this space with, people who get you. I mean, not to obviously to promote us in a way, but this is your colleagues in terms of in the nursing profession who understand it, and who have decided that this is something that is so needed for our community.
Yeah. No, absolutely. And I would say, there's a lot of wellness nurses out there who have commented, who've reached out. Just because you're not in Connecticut, you can still be a part. You can, donate, you know, uh, services. You can donate tools that you may have and you may use in your community. Um, yeah, I think it's just great if we collectively do. So, like, the vision for this summit is, it's not just about like wellness for nurses. I see it almost, and this is going to sound so cliche, like a movement, but I really see it like all nurses in Connecticut coming together to make this a huge event. Um, all nurses, right?
Mm,
So all these nursing organizations. And next year when we have it, I hope that it's bigger because we have more people collectively doing it. I think like everything in nursing, it's so segmented. Everyone's kind of doing this, like, let's do it together. Let's come together to do it. Even if you're not in Connecticut, you can still come together, right, to make this event, because there's power in numbers and, what we're doing, how we do it. That's why we're so happy we're collaborating with the Connecticut Nurses Association, CNA, which is our chapter here in Connecticut, just to have a greater impact. But yeah, even nurse leaders, CNOs of organizations, like everyone should really have a hand in this. All of the hospitals in Connecticut, Yale, I'm calling out loud, Trinity, ECHN, right? Midstate, part of Hartford Healthcare, St. Frank, whatever you call yourself, like Trinity, everyone to come together, right, to be a part of this
Absolutely.
event. It will be a powerful movement if we can really get the buy-in from everyone who say they support nurses. Nurses are important. Nurses are really driving your numbers, right, in your organization. This is it. This is where energy should really go in terms of, seeing nurses in Connecticut be well, do well, so they can really provide the best care for themselves and the people they care for. So
absolutely,
that's a big vision. This is just the start. Like, this is just like the seed, but then, as it grows, definitely.
Yeah, 100% agree. Like, this is, we of course have very, same thoughts, and on this being a movement, having been a nurse, been in nursing for a long time. It's awesome to be able, to see like the shifts. I know we talk a lot about, with COVID, and, it was like COVID, during that time, nurses and other healthcare professionals were, we were the heroes, healthcare heroes. And now we're past pandemic, but the effects are still lingering. They were there even before COVID, but, we've just in this, all right, we're moving on to the next, but, we still have, people are still hurting and still, feeling a lot as a result of that, and don't have the strategies and tools. So part of the reason why we are doing this is because we hear you, we see you, we get it. I've experienced it firsthand of what that burnout is like, and certainly want us to be able to put ourselves in a very different position, so that we can care for ourselves and keep this profession growing. I think is so huge and so essential.
Yeah. Yeah. And I also see, even I would love an opportunity, and maybe we can even create some sort of platform where we are sharing the voices of nurses in Connecticut, because there's so many stories out there.
There is.
We're talking about our own stories and of course our colleagues, but really capturing that, even, now, even for, even next year, really capturing the voice of the CT nurse, and putting that out there to really just show people how problematic it is being a nurse nowadays, right? In healthcare. However, they talk about resilience, but nurses are one of the most resilient people, because despite all of that, they still show up.
Yeah. Yeah. I will say, I know resiliency has become like that word of like, oh, like, you're telling me to be resilient in an environment that is toxic. But I will 100% agree. It's like, I don't think, excuse me, nurses have any issue at all with resiliency.
Yeah.
That's what we've been doing, starting in nursing school. Yeah. I know we talked about the other day with nursing school, like nursing school is a lot. So, you're even the beginning foundations of your career. Those steps are extremely essential. The well-being aspect lays that foundation. So, so nursing schools as well too. I know you were calling out a lot in terms of the organizations, but also nursing organizations as well as schools with students. We are offering some student rates that will be available if you click on the link to register and you enter in code student, there is an option there to be able to apply with a student rate. So as we said, we want to really be able to lay the foundation down for students as well as they're entering into the profession. And also with offering an opportunity, I know like yesterday you had some giveaway options there, but wanted to also offer an opportunity because we want to build community, as we said with this. So an opportunity, like if you're coming, but you're like, I don't want to come by myself. So an option to bring a friend. So if you get a ticket, the person that you bring with you will be half off. So like buy one, get one free in terms of, again, us building community and support. So putting that out, we'll certainly, if you actually click on the registration page, the option for the buy one, get one free is on there now. So a limited time. So be able to take advantage of that up until like tomorrow. So again, bringing a friend and some support and community as we continue to build on this movement and these discussions about how important well-being is within the profession. So definitely.
Yeah. Absolutely. Yeah. So we would love to see you guys there. Go to summit.ctnursewellness.com, get your ticket. And I would say, if you have a number of students, I would say more than 2 who are interested in attending, shoot us an email. We can, put together a package for you. So
yes.
Send us an email. It's more important that, they are there because, again, we're setting the foundation for these students.
Yeah. So, and the same also, if there's groups of you that are looking to come, more than 2 or, more than 3, certainly email us as well, too, and can certainly set up a package for you, to be able to attend because it's better together, right? It's better together.
Absolutely. Absolutely. So with that, we'll see you again tomorrow. Same time, same place.
All righty. Bye, guys.
Bye.